The topic of today's event is Fuel Your Health Nutrition Strategies and Anemia Insights for MDS patients. This is a great way to start the year. Well, we're almost near March, but even though it's a great way to start our year, Francesca and Peter, experts in oncology nutrition, will share practical evidence-based strategies and how to make the most of your diet, tailored for patients with myelodysplastic syndromes, so you can discover key insights on addressing anemia, a common challenge among those living with MDS, and learn how targeted nutrition can help you overcome dietary challenges. At the end of today's event, I'll provide my email address. If you have any topic you would like us to see or cover, please reach out to me so I can get it on our schedule. Now, let me take a moment to introduce our amazing speakers. I'm so excited to have them both here with us. So Francesca Castro is a level 3 research clinical dietitian nutritionist at Memorial Sloan Kettering Cancer Center, where she joined the myeloma services back in 2021 under no other than Dr. Ubishaw to focus on dietary intervention clinical trials. Francesca has a Master of Science Nutrition and also an exercise psychology and bachelor's of science in biomedical science. Her interests include the impact of dietary choices on both cancer prevention and progression, gastrointestinal microbiome, and evidence-based clinical nutrition care. During her free time, she likes to try new recipes and go to the park with her dog named Rigatoni. Peter Adintori is a board-certified advanced practice dietitian with additional board-certified specialties in oncology and nutrition support. Peter cares for patients with leukemia and myeloma on the inpatient services at Memorial Sloan Kettering Cancer Center. Prior to this role, Peter was a research dietitian on the blood and marrow transplant service at Memorial Sloan Kettering. He's also a PhD student in rehabilitation sciences at NYU, where he studies the role of nutrition, physical function, and mental health in patients living with and beyond cancer, specializing in blood cancers. So now I will turn the time to our speakers.
Thanks, Mary Lou. Gonna just share my screen here. Then I'm actually going to just pass it over to Francesca to get us started, but I'm excited to be here and thanks for having us.
As both Mary Lou and Peter said, we're about to get started on our nutrition strategies and anemia insights for MDS patients. Mary Lou gave us a fabulous introduction, so I'm not going to go over Peter and I's roles at MSK. Next slide. And then this is just an outline of our talk. We're going to overview nutrition. We're going to talk about nutrition during cancer treatment from a broad lens. And then we're going to talk about nutrition strategies for anemia management, and then some dietary recommendations for cancer risk reduction and in the survivorship space. And then we'll just summarize with some key takeaways. And then I have no disclosures, and Peter's disclosures are right here, but they don't affect the contents of today's presentation. And so, overview of nutrition, we just wanted to give a brief intro of nutrition and specifically nutrition research. So nutrition research plays a crucial role in shaping our understanding of human metabolism, how it affects microbiome, and how dietary exposures affect overall health, including cancer risk and reduction. Nutrition research also serves as the foundation for these evidence-based nutrition recommendations that you might hear from registered dietitians, physicians, and other allied healthcare professionals. And we included this nice graphic just to show just how many body systems nutrition might play a part in. And then some potential dietary mechanisms in cancer. Now, this is still very much being studied, but I wanted to include this as well. And we're going to talk a little bit about this in the cancer risk reduction and prevention in a few slides down. But Diet might play a significant role in cancer development and risk reduction depending on the type of cancer. These are potential mechanisms that have been studied. I'm sure many of you have heard of different dietary patterns that might help regulate the body system, reduce inflammation, improve the microbiome involvement. And I just wanted to show that here and then pass it off to Peter.
Great, thanks so much. Just to make sure I unmuted. Okay. So I want to talk a little bit about nutrition during cancer treatment. And we'll start with more of a general overview. And again, this is not necessarily specific only to MDS, but really to cancer broadly. And I'll explain a little bit more about why we sort of present it that way. And then we'll follow this up by a couple of slides on anemia. So in general, when we're thinking about nutrition during cancer treatment, these are the 4 goals that we have in working with our patients. And so the first is really to minimize weight loss during the cancer treatment process. We want you to hold on to as much of your weight as possible because that weight really keeps you nice and strong and able to tolerate treatment to the best of your ability, right? And so if people are able to hold on to that weight, they're able to be able to endure treatment that otherwise would be really challenging to endure if they were at a lower body weight, or if they're in the active process of losing weight during treatment. Also, we want to talk a little bit about food safety and why that's important for folks going through cancer treatment when your immune system is compromised, some common symptoms that might come up during treatment and how to manage those. And then one of the things I think is the most important is to protect your relationship with food and your body. So for minimizing weight loss, we know this can happen for a variety of reasons, this being weight loss. And one of the main reasons is because our appetite really tends to decrease during cancer treatment and really just makes eating not as desirable as it is during, regular life. It also may change the way food tastes. You may have symptoms that might make you uncomfortable while you're eating, like nausea, vomiting, diarrhea, constipation, things like that. Also, energy levels may be low, and when you're fatigued and tired, the last thing you want to do is prepare food, eat food, all of these things. So really, it's important to know how to eat while you're feeling so low energy. And then also there are certainly sources of stress and challenges to our mental health while we're going through cancer treatment, right? It's a lot of stress, a lot of uncertainty. And so these things are really important to recognize, and they can all contribute to losing weight. So on a general level, what we think about is really reframing how we think about our meal structures to go away from a breakfast, lunch, dinner mindset and really think about smaller, more frequent meals, which I tell my patients happen every, say, 3 to 4 hours or so, without that being a hard and fast rule, but really a guideline. And really, when we're choosing what we want to eat, we should be reaching for foods that are a bit higher in calories, higher in protein, to keep ourselves nice and fueled. So if you're having a small amount of food, if that food does hold higher calories, higher protein, it can be really useful in order to kind of keep your body weight on throughout the treatment process. I also like to highlight the reframing of healthfulness. And as a dietitian, I'm often asked, how do I stay healthy during treatment? And my answer is not always eat as many fruits and vegetables as you can, especially while you're going through treatment, because that just may be really difficult. And what we know is most important is that you're eating foods that are able to be tolerated and don't cause you more symptoms. And so for a period of time, that may not necessarily be the most quote unquote healthful foods. It may include things like milkshakes or smoothies or other higher sugar beverages that really help get you the calories and the energy you need in order to go through the day and to endure your treatment. I also will promote here being gentle with yourself, and that's something I will say throughout this talk, because being gentle with yourself is really important. I find many patients are usually the hardest on themselves. They get really discouraged when they're, having a hard time with things. And I will say we have so many of our wonderful healthcare providers that are here for you and encouraging you to really be gentle with yourself and give yourself that grace while you're going through treatment, because it certainly is not easy. And then lastly, moving your body as able. Movement is just as important as diet, even though Francesca and I are both dietitians. We both strongly recognize the role of movement in sort of supporting what you're doing with your diet as well. And so doing that in a way that feels comfortable is really important. And I'll sort of talk about that a bit in the context of anemia shortly. Next is practicing food safety. So as you know, or as you may know, during the process of cancer treatment, your immune system is compromised, meaning that you're not less likely to be able to fight off infections or food poisoning that otherwise you would be able to fight off pretty well when your immune system is intact. And so we know that the risk of foodborne illness is the same as someone who is not immune compromised. However, if someone were to get foodborne illness, like salmonella or one of the other bugs that you may have from food, it's really, really difficult to recover, right? So if I were to get that in my current state where I don't have a compromised immune system, I may have some really awful days in the bathroom and I may have to go to the hospital to get some fluids. And, I'll generally recover after a couple days, depending on how serious the infection is. But for folks that have a compromised immune system, getting a foodborne illness or other types of infection can really lead to prolonged hospitalizations and a lot of complications that just make treatment a lot harder to endure. So what we do now is we recommend folks to follow these 4 steps: cook, chill, separate, and clean. And so with cooking, getting a meat thermometer to take internal temperatures of proteins is really great. Making sure that you're chilling your foods in the fridge rather than on the counter or somewhere else or in the sink. Food that need to be defrosted. That way they never raise above the temperature of the refrigerator. Separating cutting boards because there may be cross-contamination if you're using cutting boards for both raw proteins and vegetables or other types of foods. Making sure to keep your hands nice and clean and as well as utensils. And then using leftovers for 2 days maximum after you take them. And I'm happy to give more sort of general tips as folks have questions about this. This is something I talk about probably almost every day of my life. So thinking about some common symptoms that you may engage with or you may experience during treatment, there's these 3 categories that I've sort of broken these up to. And the first is things that make it hard to eat enough food, things that make you afraid to eat anything, and then things that make the eating process and the eating experience less enjoyable. And just as an important reminder here, each of these symptoms that you experience is personal to your own experience with treatment. So every person I talk to has a different experience with treatment, even if they get the same exact regimen of chemotherapy or other types of therapies, because their bodies are different, their, overall how well the person feels is different. And so someone that experiences nausea may experience it very differently than someone else. And so I always like to individualize my approaches to each patient because you may experience things very differently than someone else that may be going through the exact same treatment as you are. So to start with, when it's hard to eat enough, we talked a little bit about appetite as one piece. Setting reminders for eating around the clock is really great as a way to kind of trigger your mind to say, okay, has it been a little bit of time since I've eaten? Also, we have to recognize that both food and liquids make us feel full. So when someone is having foods, I usually recommend for them to have their beverages between meals and not necessarily having a full beverage with a full meal because that's decreasing the amount of space in your stomach that can really hold food. Going for foods that are easily prepared and nutrient dense will really allow for you to get food in more easily, and having some light movement can help stimulate your appetite a bit. Similarly, if you're feeling full quickly, choosing those higher foods, higher calorie, higher protein foods, make every bite or sip count is sort of a way to think about it, is what I tell patients. Listening to your body. So if you're feeling really full, not to push it. We certainly don't want you to feel overly nauseous or vomit or anything like that. Making sure you have foods that are convenient to you available, and leaning on liquids because we know those go through our system, our body system, a little bit more easily than our solid foods. And then when it comes to mouth and throat pain, that you may experience, you'll want to try different food temperatures and textures. Again, I've heard everything under the sun for what food textures and temperatures feel best for folks. People tend to not really enjoy hot foods or things that are sharp or crunchy, like say a potato chip or a cracker or even like toasted bread, things that just tend to be really sharp as they go down. And also foods that are really highly flavored or acidic may cause burning or discomfort. So those softer, moist foods, liquids, things that are cooler or at room temperature tend to be better tolerated. So now when you're afraid to eat anything because you're afraid of having symptoms, so this could be when you're having nausea or vomiting, when you're having diarrhea or when you're having bloating or gas. There's with nausea and vomiting, my best tip there is to avoid your favorite foods while you're feeling nauseous, because we certainly don't want you to associate that food with your nausea going forward. I always give the example of someone's sort of home family recipe for a special dish. Say, I'm very Italian, so like a pasta sauce or a pizza, something like that. I've had many patients tell me I haven't been able to eat pasta or pizza for many months. And I certainly never like to see patients have to remove things from their diet that they really enjoy just because of that nausea, right? So I always tell people, eat things when you're nauseous that you don't mind kind of taking a break from for a little while, then you can always go back to those foods if they're, not as bothersome to you later on. And usually those are things that tend to be more bland, don't have strong flavor, so things that you would probably take it or leave it if you're trying to eat it. When it comes to diarrhea or loose bowel movements, you're often losing a lot of water in those bowel movements as well. So you're at high risk for being dehydrated. And so I always encourage folks to have hydration readily available and also include electrolytes as able, because you are losing some electrolytes through that. So that could be in the form of something like a Gatorade or other electrolyte containing beverages that can really help replete those electrolytes that you're losing in the loose bowel movements. And also trying to avoid foods or trying to avoid things with high fat, lactose, or coffee, because those can really, in some cases, depending on the person, stimulate bowel movements that are a little bit more loose and a little bit less comfortable for someone. So certainly don't want to add any fuel to the fire. And lastly, there's sort of the colloquial brat diet that people have heard of, which is bananas, rice, applesauce, toast, adding oatmeal and potatoes to that. These are things that can kind of help firm up your stool a bit and make it a little bit more solid. And then lastly, with bloating, something I like to always recommend is to limit straw use, because you're inhaling air during that process and that can lead to some of that more gas. So if you're feeling like you're, having a beverage with a straw and you're getting bloated afterward or feeling gassy in your stomach, then that is one fairly easy strategy to avoid that straw use, and you can sip out of the, glass or the mug or whatever it is that you're drinking out of just from the glass itself. Also, just eating slowly, chewing small pieces, and then talking to your doctor or dietitian to find a source of bloating. Bloating and gas can be really uncomfortable, but they can have pretty easy solutions once you find the cause of the bloating. So having that dialogue with someone else can be really helpful for just getting to the bottom of what's actually causing that problem. Okay. And now for when you're not enjoying eating, which is extremely common, right? Going through the cancer treatment process. If things start to taste differently or taste poorly, try to describe these changes to your dietitian or to a nurse or to a doctor, whomever it is that you're interacting with. Obviously, I'm biased as a dietitian that we have a lot of experience with this and we talk to patients about this all the time, but certainly your nurses and your doctors will also have experience with this and can sometimes provide helpful strategies, or they can refer you to the dietitian if you're not sure how to get in touch with a dietitian to really help you with that. There's a way where if you're tasting the opposite taste, so if something's really sour, really bitter, you might add something sweet to it to kind of counteract that bad taste. Or oppositely, if something's really tasting sweet, you can add something salty or bitter or sour to it to really cut that sweetness. Same thing with savory. And in that vein, if you're not able to taste these tastes and you really feel like everything just tastes bland, you can always add additional spices or salt or citrus to really boost that flavor up. And I usually recommend if you are the caregiver of someone going through cancer treatment, if you're preparing the meal, to prepare a meal for yourself that sort of has a normal amount of spices in it, and then have a version that's kicked up a little bit for the person that's having a hard time tasting things. That can be really helpful for really allowing someone to access that taste a bit and those flavors. Taste changes go hand in hand with dry mouth. So when you're having a dry mouth, keeping yourself nice and hydrated, including foods with sauces, practicing good oral hygiene, and then having hard candies or mints or frozen grapes or ice or even citrus can kind of help bring that saliva out of your cheeks and really allow it to be accessible to you. And then lastly, when you're experiencing sadness or fear, feeling depressed in any way, I think it's really important to recognize this can have an impact on your appetite in many ways. So having conversations with your family or caregivers about what you're feeling and what you're going through. If you're not in contact with a social worker during cancer treatment, I find social workers to be extremely valuable support systems for you to really understand what's going on. They're trained specifically in listening and understanding and giving you strategies to really move through those challenging emotions. And so we certainly don't want you to just ignore those emotions, but we want you to be able to sort of have space to speak through those. And also setting up a special eating area for when you're eating, and being in a place that feels comfortable. So if you're in the hospital while you're getting your treatment, which is the case for some patients with MDS, setting up a special area that's not in the hospital bed can be useful. So in our hospital, that tends to be in a chair at bedside or a little lounge or whatever they have in the room. And so patients have sort of like an eating area that they set up. And I always say folks can use music or media to kind of improve their mood around eating. And I have many patients that have like eating playlists and things, or have, certain media that they'll watch a show on Netflix or something like that that they'll enjoy while they're eating to kind of help, improve their mood and their overall how they're feeling while they're eating. As I said earlier, these symptoms and how you manage them is an experience that is your own. It's personal to you. I will also say to make sure you're advocating for yourself and your needs. If you feel like your nausea is not controlled, your bowel movements are not comfortable, you're having a hard time, there's almost always a medication that can be tried, or an other intervention like a dietary change or things like that, that our brains as healthcare providers can put our brains together. But unless someone's advocating for themselves, it's really hard for me to know what's going on, right? So I, as a healthcare provider, always try to create a really open and welcoming space for someone to share what they're going through and to have that advocacy. But I always like to encourage patients to really raise their voice up and make sure that they're being heard when they're advocating for themselves. I would also say, and you'll hear me say this at the end as well, to take each day one meal at a time. So if you wake up in the morning and you're having a really great breakfast, that's fabulous. Keep rolling with that. If you wake up in the morning and you're having a really hard time and breakfast doesn't really feel reasonable for you, that's absolutely okay. Just look to the time that's in a couple of hours when you're feeling a little bit better and you can try again, right? So not to sort of let how your day starts really affect the rest of your day. We talked about small, frequent meals high in calories and protein, and then talking to a dietitian can be an extremely useful resource here when you're going through symptom management. Oops. Okay. And then lastly, with protecting relationship with your food and body. Now, this is something that doesn't get talked about enough, but can be really important while you're going through treatment and afterward. So the experience of having all these symptoms when you're eating and just being uncomfortable can really make changes in how you're eating and the pattern in which you're eating, and also maybe your body weight as well and your body composition. So you may feel a little bit weaker. You may see that you've lost weight. You may see your clothes fitting differently. And these are all signs that maybe your body's not getting quite enough nutrition. And we recognize that food is just one tool for health, and I'll talk about that a little bit more at the very end. But to not only put stress on what you're eating, how much you're eating, and all of that, but really recognizing that food is just one of the ways in which you can help yourself feel well. It's one of the things, in addition to movement and sleep and having great relationships with other people, taking care of your mental health. These are all things that can really help you feel well. And they're things that you can do well for yourself during cancer treatment itself. Also recognizing that many of these symptoms won't last forever, so it's really, really hard while these are going on. And some of these symptoms linger a little bit longer than others, but recognizing that these symptoms will go away at some point can really help you have an experience with um, food and with your body that is sort of recovering in some way. So kind of having that light at the end of the tunnel mentality when it comes to the symptoms you might be experiencing. And then, as I said earlier, being gentle with yourself and your needs each day is really great. And I'll talk about that in a few slides with anemia specifically, and it's very important with anemia. Okay, so let's talk about this in general. So I get this question a lot is what is the diet that I should have with this type of cancer? So there's lots of old books now that are about the blood type diet. And is there a specific type of diet that I should have from my blood type? And maybe that's better for me while I'm going through treatment. And there's really no research to support that. Um, and the reality is that a balanced diet that has lots of vegetables and plant foods in it will be helpful both during and after treatment as tolerated, right? So if you're feeling really, really poorly during treatment and you can't reach for a lot of plant-based foods, that's absolutely okay. There will be opportunities in the future for you to include those foods. And we take it on a meal by meal basis, as I said, but as a bigger picture general strategy for how to eat well during and after treatment for MDS. That plant forward, balanced diet that kind of looks like this plate here is a really good sort of visual cue for you to include, plant-based proteins, to include whole grains. And Francesca will talk about this a little bit more in future slides too. Now, when it comes to nutrition and anemia specifically, we know that anemia happens during MDS because your numbers of your blood cells decrease, including your neutrophils, which are the blood cells that affect your immune system. And there's also degrees of inflammation that happen, which is just a natural process that happens when someone has a diagnosis of cancer. And that can just cause the body to have an anemia type picture based on really what's happening underneath the hood, as I like to say, is really under your skin. There's a lot of activity going on when you're getting cancer treatment. There may be some nutrient deficiencies, and usually those aren't treated directly when it comes to anemia, the way that I would treat someone who doesn't have a diagnosis of blood cancer. So I'll kind of treat it a little bit more carefully. And then you may also have side effects of treatment that will sort of cause your blood cells to be lower and also have some picture of anemia. And something we think about a lot with anemia is iron. And there are some patients that have anemia because of iron deficiency. However, blood cancer patients also often get blood transfusions because their blood counts tend to be so low. And typically, with those blood transfusions, we're also giving iron-rich blood. And so, if you're giving iron or eating really high iron-rich foods, and you're also getting iron in the blood, it can actually lead to a condition called iron overload, where there's too much iron in your body, and that's not very safe. So any of the supplements that we provide to patients, like a vitamin or something like that, that might be helpful for them, typically are free of iron in order to avoid that complication. And then lastly on this slide, we want to emphasize that diet can play a supportive role for your anemia, but it certainly shouldn't replace your medical treatment because that will be the most effective in getting your blood to really be as healthful as possible and to be as supportive of your overall wellness as possible. And the example I always give when I talk about anemia is that during the process before you're getting a blood transfusion, or maybe you're getting it that day, you are going to be exhausted. It is absolutely terrible to have those really low counts and you feel so tired. And then patients I see the next day after a blood transfusion are feeling wonderful and they feel so much better. So these blood transfusions can really help And so understanding that pattern and how you have more opportunities to move your body and to eat more when you're having higher energy levels can be a really great strategy for really helping yourself to feel well. Here are some of the signs and symptoms of anemia, and I don't necessarily want to just read these at you, but broadly, they tend to just make you feel tired, weak, fatigued. You may just feel sick overall, like you have a cold. You may feel dizzy. You may feel short of breath. Oops. So these are things that you want to keep an eye on because they may tell you, okay, maybe I'm having a hard time with my blood cells right now, and I should talk to my doctor. Now, a lot of the people that I've seen over the years that have a new diagnosis of MDS or leukemia tend to present with these types of symptoms as well. So these are things that tend to be very real for people, and they are having a sort of recent memory of these symptoms. So these are likely things you will experience and then sort of have a trigger for to kind of know what's going on. And so managing these types of anemia, right? So we can kind of classify these anemias into iron deficiency anemia itself. So including iron-rich foods in your diet, including foods with vitamin C to improve the absorption of that iron that you're getting from the foods into your body, and then avoiding calcium-rich foods or calcium supplements, tea and coffee when you're having iron-rich foods because those sort of compete with one another. So it's important to really make sure you're having those iron-rich foods separate from those others. Um, if we know that your anemia is due to a deficiency in either vitamin B12 or folate, which are just two different B vitamins, there are wonderful food sources of both of those things. So there's pretty much any animal source of protein or any dairy will have B12 in it, and there are some vegetarian sources, such as your nutritional yeast, some seaweeds or algae also will have it as well. And then your folate sources, I always think of green leafy vegetables, but there's others too that can help with the folate. And usually, if this is actually diagnosed deficiency of anemia due to vitamin B12 or folate deficiency, your doctor will prescribe a vitamin supplementation, whether it's given as a pill or given as an injection for you to kind of get that easily absorbed into your body. And then, as I said, for many of our patients with anemia that are dependent on transfusions, we want to limit our iron-rich foods, having focus on plant-forward and anti-inflammatory foods that can really help us feel well and kind of support our bodies overall. We can use iron-blocking foods like the calcium-rich foods, tea or coffee as needed. And then avoiding iron supplements if it's medically necessary to do so. And again, I would talk to your doctor about that because they are often looking at this very closely and know exactly what you need. And then when it comes to these symptoms I was describing, when it comes to fatigue and weakness, we talked about this a little bit before, but listening to your body and what you can handle that day, having small, frequent meals, and having carbohydrates and protein at all your meals to really give you that energy, and also staying hydrated, right? The symptoms of dehydration and the symptoms of anemia are almost exactly the same. So often patients need to be hydrated well, especially with electrolytes when their anemia comes up. And if people are especially feeling dizzy when they're getting up from like the chair, the couch, or the bed, when they're moving fast, you've probably had that before where you've gotten those like little stars that you feel. It's important to make sure you're hydrating with also having some electrolytes in there because you may be getting a condition where your blood pressure drops a little bit, and that hydration is a really big piece of helping you feel well. And again, carbohydrates at all meals and snacks for that dizziness, that headache. And then the key here is to be gentle with yourself, move and eat slowly, and fuel your body throughout the day with both food and fluids to really make sure that your body system is feeling well overall. So with that, I'm going to pass back to Francesca to talk to us a little bit about risk reduction for cancer and survivorship.
Thank you, Peter. So this is just a overview, a brief overview of what I'm going to discuss in the coming slides, but I wanted to share this World Cancer Research Fund recommendations, which do a really good job of summarizing all the available evidence. I highly recommend visiting their website. As you can see here, there's a few items in which they recommend to limit, and then there's a few items in which they recommend to increase. So starting off with what you can add to the diet, the recommendations based on the evidence are plant-based foods, as Peter mentioned throughout this slides, as well, such as fruits and vegetables, really eating the rainbow. We've seen with a lot of the evidence is that variety is important, not only for getting different micronutrients, but also for microbiome diversity and beyond. And then also increasing things like nuts, seeds, and beans, which will be your plant-based sources of protein, and then increasing whole grains as well, and increasing plant oils such as olive, sunflower, and avocado oil. And then also including more daily movement, of course, choosing a movement that you enjoy. As Peter said, I'm very much of the realm of recommending movement that feels good to you. So you might see something on social media where people are recommending you need to run a 5K. If you don't like running, I don't recommend running. Of course, it's always nice to try new things, but if you like dancing and that's where you want to get your movement in, then go for that. If you like walking, then go for that. Make it social and involve others, and of course, listen to your body. If a type of movement doesn't feel good, talk about it with your care provider, and then figure out a movement that does feel good to you. And of course, always be kind and gentle to yourself. And then some foods to limit. Does not mean you have to avoid them altogether, but to limit based on the evidence is red and processed meats, substituting those things with leaner meats, mostly like poultries, turkey, chicken, eggs, fish, or plant-based proteins, as I touched on previously. And then also limiting highly processed foods. So foods that we might find in the grocery stores that are high in sugar, salt, and saturated fat, and replacing those with some of the more plant-forward foods I talked about previously. And then some evidence has also showed that added sugar and sugar-sweetened beverages have an increased risk of cancer overall and cancer-related outcomes. So things like juices, sodas, sweetened teas, substituting those with water, seltzers, unsweetened teas, or even diluting those and reducing the amount over time. And then the overall recommendation is to limit alcohol as much as possible for cancer risk, and then also to limit supplements and vitamins unless medically appropriate and deemed by your care team. As Peter mentioned, I never recommend taking something unless you've discussed it with your care team, especially because they're taking a close look at your labs and they understand any interaction effects that might occur with some medications that you're on. And so, where to start with risk reduction and survivorship, and even just overall eating in a more healthful, plant-forward diet pattern? It does not have to happen overnight. Consider individual goals and start small and build. Think about your breakfast, lunch, dinner, and think about what meal you can work on first, and think about what swaps you can do. Maybe instead of having only white potatoes with a piece of meat, thinking about including half of the amount of potatoes and including a non-starchy veggie like broccoli or spinach or kale. Slowly opt for higher fiber items. I know a lot of the research shows that high fiber can be beneficial, but if you increase fiber too rapidly, it can cause some GI disturbance. So it's best to start slow. And then, of course, work with a registered dietitian if you're curious what your individual needs are, and they could be really helpful in helping you consider your goals and building those goals to be individualized for yourself. And then for more information, I already touched on this. The World Cancer Research Fund is a great place. They work with the American Institute of Cancer Research, which also shows different cancer types, different risk factors, and then the overall evidence. And it's important just to note that all data is based on associations. A lot of the data is not based on causations. So that just means that a lot of it is observational, and we don't have definite evidence as of yet. And it's also, of course, important to note that no current diet or physical activity data for MDS risk or relapse is available. So do what is best for you and what works for you in the moment. And then these are additional resources. And then AICR also has a nice checklist on eating well and moving more, which I find to be really useful. And they're small, achievable goals that I think are easy to work on and to adapt to yourself. And now giving it back to Peter just to wrap us up so we have some time for questions.
Great. Thanks, Francesca. So, just to wrap this all up, things that we've said throughout this that I think I really wanted you to take home with you are to find a dietary pattern that works for you. This is something that I stress with all of my patients is that there's no perfect regimen or perfect way to do this. It's really what works well for you. And when you know you've found something that works, it's something that's balanced. It feels gentle. It doesn't feel like it's overly restrictive. It's something you can do consistently. You're not going to come back to me in 2 days and say, Peter, this is awful. I'm not doing this anymore. Or in 6 weeks and say, like, I tried it. I hate it. I'm not doing it anymore, right? We want you to be in a pattern that really feels like something you could do long term. And also it's personalized, right? So it includes foods that feel like home to you. So it's foods that you've grown up with or that give you great memories, right? There's always ways to include healthful foods in your diet from a variety of different sources. I've said take it one meal at a time. That's something I always hope sticks with my patients. And then as I alluded to earlier, the American College of Lifestyle Medicine has these 6 areas where we can improve our health. And there are things that I feel that we can really focus on while we're going through cancer treatment. And then when we're after our cancer treatment in the survivorship phase to really say, okay, what can I do for me, right? And that can either be healthful eating, choosing healthful foods as able, moving your body in a way that feels comfortable, managing sources of stress, forming and maintaining relationships with folks that really enrich you in some way, improving your sleep patterns and your sleep hygiene overall, and avoiding risky substances like smoking and alcohol that do have some associations with cancer risk across the board. So these are things that we can sort of work on over time. But I always like to say they're each one slice of the pie. And so you can say to yourself, okay, what's going well within all of these areas and where do I have room for improvement? And being able to take that balanced view can really help with how you feel overall and how you perceive your overall health and wellness. And then just to note here, we have some resources we're not going to walk you through, but Francesca was so kind to put these together for you. So some things about the guidelines, some grocery store staples for our different types of plant-based foods, and then also some nice ways to read the nutrition label that can sometimes be difficult to understand what's going on with all that math on that piece of the label you're looking at. Okay, so with that, I'm going to stop sharing and we'd love to hear what's on your minds.
Awesome, thank you. I'm gonna go back to sharing. Okay, so thank you both, Francesca and Peter, for that way informative presentation. It's a great way to learn about nutrition. And it's time now for the discussion part of today's webinar. If you have any questions about nutrition, nutrition-related anemia, all those topics, or anything Francesca Peter spoke on today, now is your chance to ask your questions. This time is especially set aside for community members to talk about it. And in the meantime, we get those questions. I think you already mentioned it, but to be clear for everyone, can nutrition alone help improve anemia, or is it more of a supportive strategy alongside medical treatment?
Yeah, so I think it's a great question. It's one I get all the time. So nutrition is usually, unfortunately, not powerful enough, and I'm the first one to be humble enough to say that we can do a lot of things as dietitians with food, but there are certain things that food is just not powerful enough to do for us. And anemia, while we have blood cancer, is one of those things that really we need some medical intervention, whether it be a transfusion or medication or some other treatment to really help bring those numbers back up.
Awesome. And I think we started getting a few questions. So um, they ask, are there any known interactions between common MDS medications such as hypomethylating agents or luspatercept, um, and specific nutrients that I should be aware in my diet?
This is a great question. So not to my knowledge, are there any food-based nutrients that might interact? And that tends to be the case. One that could be that I just don't know off the top of my head that interacts with lots of things is grapefruit. So grapefruit juice or fresh grapefruit. Um, those two medications, I don't know if there's a grapefruit interaction off the top of my head, but what I will say is for many foods, when we're talking about food-based sources of things, there's so many steps in our body before that food actually gets into the body, right? You have to chew it and digest it and absorb it and all of that. So often our body is actually very good at taking the nutrients they need and getting rid of them when they don't need them. And so I always give the example of like a B vitamin that people's pee tends to be extremely yellow when you take a vitamin because you're peeing out a lot of those high vitamin nutrients, because your body just gets rid of the excess. And we don't want to make that a pattern because it can sometimes decrease how effective our treatments are. So when we're thinking about interactions with medications, we're almost always thinking about supplements themselves and not necessarily whole foods or even some processed foods will be normally okay. So nothing raises a red flag. And Carla, that's a great question.
Awesome, thank you. I've heard about that for specifically with medication, so good for pointing that up. We have another question. It's kind of a double it. So, does eating more protein help with red blood cell production in MDS, or is it mostly about iron? And then he asks another question. I've heard that iron supplements can be risky for MDS patients. How do I know if I should be taking one?
Francesca, do you want to take this one?
Sure. So great question. Eating more protein doesn't necessarily help with red blood cell production. Overall calories can. Much of protein, if you're eating animal-based, has iron in it, so that also helps with iron absorption. But it really depends on your overall balance of your diet. Iron supplements can be risky for MDS patients. However, talking to your care provider and determining if in your blood work it shows that you are iron deficient anemia and to determine what dosage might be best if they recommend a supplement. But overall, eating a well-balanced plant-forward diet, really you shouldn't have to worry about additional supplementation.
Awesome, thank you. We had also a question from Mary. I receive blood transfusions regularly. Should I be following a special diet to support my body after transfusions?
So, Mary, this is a great question. I think with the post-blood transfusions, there's not necessarily any specific diet that you'll have to follow. As I said before, if we're thinking about iron, which we've been talking about a little bit, the iron itself, if it comes from food sources and especially plant-based food sources, will not affect your um, risk of that iron overload complication I mentioned. So a lot of the general strategies for anemia, so, having small frequent meals, having adequate hydration, these will be fabulous supports for you while you're going through that transfusion and sort of afterward. I will say many patients are sort of on the struggle bus on the day of the transfusion or right before, but then after the day of transfusion, they tend to feel much better. And I'm sure you've hopefully experienced something to that effect, even if it's not as different as I've just described. But after the transfusions, really just keeping yourself nourished throughout the day, both with food and fluids, will just help you have enough energy to, keep doing the things you need to do throughout the day.
Great. We also receive the questions. There are a few MDS patients that, besides MDS, they go with diabetes, kidney disease. So, how should dietary recommendations be adjusted to manage both anemia and overall health without worsening either condition?
Great question. Fortunately, a lot of the recommendations overlap, and a lot of the recommendations and supportive methods we discussed today are actually beneficial for both diabetes and kidney disease and overall health in general. A lot of what we discussed and a lot of what Peter recommended would be even things I would recommend it in a general nutrition setting: adequate hydration, plant forward diet, increasing fruits and vegetables, increasing movement when feasible. All of those things are relevant, not only to this setting, but in overall health, including other states like diabetes and kidney disease. I don't know if Peter, you have anything to add.
No, I think that's absolutely it. I would definitely say to speak with your medical team as well, because each of our comorbidities is managed at different levels. So if you're doing really well with your diabetes management or kidney disease management, then maybe there's nothing that has to happen with your diet. But if you're in a state where it's more difficult to manage those conditions, there may have to be certain considerations for diet in those circumstances. So I usually take it on a case by case basis. But most of my patients that have those conditions are on just like a regular diet because during treatment it's so difficult to eat enough as it is. So I don't want to add any other complications to figuring out what foods work best for folks. So I would say it definitely, I hate to say it depends, but it really depends on a case by case basis of really how well those other conditions are being managed at the time.
Thank you. And it does make sense. That's why we personalize treatment and we personalize everything, right? Also, there's a lot of buzz around superfoods, herbal supplements, and alternative nutrition approaches. Are there any that have a real evidence supporting their use for MDS patients or at least for blood cancer patients?
So I would say no, which is always the like, it seems like I'm like the crabby uncle in the room that says it, but um unfortunately a lot of the way that these things are promoted are through sort of commercial entities that really want to benefit from promoting a certain product or supplement or otherwise. And many of these things, superfood is a buzzword that I wish held more strength because I would love to be able to identify superfoods for my patients to sort of reach for. The superest of foods that we have are going to be your fruits, vegetables, whole grains, plant-based proteins. Those are going to be helpful for you always. And if you can tolerate those, include them as much as you can. Getting a variety of them is always great because you get different benefits from each one. Um, as it comes to supplements, one thing I always like to mention when I'm talking about supplements is that in the United States, at least, our supplement market is not regulated by any means. So if you get a bottle that's, of, say, a certain vitamin or something like that, from a supermarket, even if for supermarket or from a vitamin store, even though the person that works there is super knowledgeable and lovely and sells it to you and gives you all of this, they may not actually know what's in the product because no one's checking, right? So they know as well as the advertisers know, but unless it's tested in a third-party lab, so say Francesca was marketing a supplement and then I tested it in my lab, that's the only way that we could really trust it. And so that's done sometimes, and unfortunately, those aren't really done often until there are multiple complications with a supplement with different consumers, and then they're pulled from the shelves. But our system that we work with supplements is not great for people that have chronic diseases or have, cancer, certainly, because we don't know what's in those supplements. And so it's really like rolling the dice, and I don't ever like to take those risks with my patients.
Thank you. And to finish the Q&A, I think we mentioned this on our previous webinar, but I think it's worth explaining, like, when a patient asks, like, or they relate, when we said nutritionists, we tend to associate healthy food with expensive. So I just wanted to touch that, like, how do you encourage patients to follow healthy habits without feeling that they need to spend a lot of their money?
Definitely great question. I think one of the first things is to start small, thinking about it, the fact that it doesn't have to be a complete overhaul of your diet. Thinking about what you can add to the plate to make it a little bit more nutrient dense, a little bit more variety, a little bit more color. A lot of people think they have to buy fresh fruits and veggies, boil beans, things like that. No, canned beans, canned fruits, canned vegetables, and frozen fruits and vegetables are all equally nutritious and can be used and actually kept longer, so you don't have to worry about them going bad quickly. As well as, name brand items like store-bought peanut butters and store-bought brown rice. They can actually be sometimes often cheaper than a lot of the animal-based products. So thinking about those things, going to different stores, seeing what's economically feasible for you, and including them when able, and not thinking about a complete overhaul of the diet.
Awesome. Thank you. So I think that's all the time we had today for the Q&A. Once again, thank you both, Francesca and Peter, for sharing your knowledge and spending some time with us today. Before we wrap up, I just wanted to highlight a great resource for those looking to learn more about anemia and MDS. Last week, we hosted an event titled Living with MDS, Approaches to Managing Anemia with an MDS Expert. In that session, Dr. Benton explored treatment options, lifestyle adjustments, and supportive care strategies. So here, when you enter to our website, you just click under community and then all events, and you will see all the webinars we have upcoming. But if you click on past events, you will be able to see all the past events we had. You can see the recording, you can see a recap, so you can check that out. I'll be sharing the direct link to the event in our follow-up email, so be sure to check it out. Once again, thank you, Francesca and Peter. And as a reminder to everyone, we would appreciate you taking 2 to 3 minutes to fill out a brief survey. As soon as you close the event, Zoom will prompt you to that survey. Mary and I are very excited about the program we've put together for 2025. This year, we've taken your feedback into account to shape the content, and we encourage you to keep sharing your suggestions. So we have more exciting events in the planning process for upcoming months. But on March, we will address transfusion. What are the benefits? What are the risks? And how can they be managed? When should action be taken? And what strategies are the best for long-term care? We will have a nurse practitioner from Duke with extensive experience on MDS patients, so stay tuned for that. Remember the link to sign up for any upcoming events and even more events I haven't mentioned today. You can find it at the bottom of this slide and will be sent out in the following up email. And finally, I just want to say thank you all for helping us build our community. I've added my email to this slide, so please do not hesitate to reach out to me. If you have any topic suggestions, if you just want to say hello or anything, I will appreciate that a lot. I appreciate you all, and I hope you have a great rest of your day. I truly hope to see each of you in another webinar soon.